Good afternoon, everyone. I apologize. It looks like we are having some difficulty with the Facebook Live broadcast again today. Thank you for your patience. We will share the video after it's recorded. Today is Wednesday, April 15th. Thank you for joining us for the Riley County Coronavirus Update. My name is Vivian Uccello. I'm the Public Information Officer for the event. Joining us today, we have Julie Gibbs, who's the Riley County Local Health Officer, as well as Kurt Muldrup, Assistant Director for the Riley County Police Department. And then today's guest is Heather Ritchie. She's the Child Care Licensing Supervisor for the area. She's going to be talking specifically about the extension of the child care provisions, Local Health Order number 6. And we'll start with a brief statement from Julie.
All right, thanks, Vivian. Hi, everyone. As of today, April 15th, Kansas has 1,494 positives statewide, with 342 hospitalizations and 76 deaths. Riley County now has 25 confirmed positives, and 8 of those have recovered. We are still gathering more information on our 2 newest cases. One patient is a 44-year-old female. The other is a 20-year-old male. We are currently monitoring 20 individuals, and we have 9 tests. In accordance with CDC guidelines, we highly recommend you wear a cloth mask in the event that it will be hard to maintain social distancing. This is a great way to stop the spread, as some individuals may be asymptomatic, but still carrying the virus. We do strongly encourage business owners and managers to require employees to wear cloth masks in the case where social distancing might be hard to maintain. This will help to protect the customers. We have partnered with Westview Community Church, as their facility is now a central location for donated masks as well as a distribution point. Please visit their location at 615 Gillespie Drive anytime from the hours of 11 a.m. until 3 p.m. on Mondays, Wednesdays, and Fridays, or on Saturdays from 9 till noon. Please consider donating a mask, or you may pick up a mask during those times. Remember that you can also make your own mask. For more information on how to do that, please visit the Riley County Health Department's Facebook page. We are still encouraging anyone with questions to email us at rileycountycovid19@gmail.com. If anyone is experiencing symptoms, please call the screening line at 785-323-6400. We do have healthcare professionals available to answer those calls every day from 8 a.m. until 10 p.m. Again, that number is 785-323-6400. Due to the increase in the amount of positives countywide and statewide, and because we now have community spread, I have decided to extend the order on child care facilities. Based on this order, child care shall be carried out in stable groups of 10 or fewer. Children shall not move from one stable group to another. Child care providers shall remain solely with one stable group of children, and the providers should be taking temperatures of each child upon arrival, and again just before leaving the facility. We greatly appreciate all of our child care providers, as they do a wonderful job keeping our children safe and their families safe as well. We know it's vital to have child care available to our parents who still need to work at this time. We also just found out that the governor's stay-at-home order has been extended until May 3rd. It is very important that we abide by this order and continue to stay home unless you need essentials. I want to thank everyone again for your dedication to this order and for your hard work. We've been together in this from the beginning, and we will continue to see it through to the end together. Thank you.
Thank you, Julie. I want to take this opportunity to reemphasize the importance of the principle behind the governor's stay-at-home order as it relates to social gathering. It's hard to practice social distancing and good hand hygiene protocols in larger groups, such as the house parties or barbecues. These activities tend to bring a variety of people together, which only increases the opportunity for community spread. And as the weather becomes nicer, the temptation to gather like this is only going to increase. So please continue to stay the course so that we can slow the spread to the point that the governor can lift this order and we can all begin the process of getting back to normal. Remember, you're not only protecting yourself from being infected, but others, but you're also protecting others from you. The CDC indicates that you can be contagious before you're symptomatic, and there are some people who can have the virus and not even experience the symptoms. So I want to encourage everyone to make use of the technology available to us today and stay connected. Use apps like Zoom or Marco Polo or Facebook Live like we're doing now, FaceTime, even dare I say, use the telephone to stay in touch with your friends and family. I know with my larger family, it takes all of these for me to stay in contact with everyone. So again, stay home and stay safe so we can put this all to an end very soon. Thanks.
Thank you, Kurt. That's good advice. And I know you've got a lot of family to keep in touch with, so I'm glad you're able to reach out to all of them. So Julie, you mentioned the extension of the governor's order, and I know that our partner extension of the child care order was, to go along with that. Heather, specifically, I think I'd like to get some feedback from you about how local child care providers are experiencing the changes. What have they seen? What questions have they had for you?
So first off, I just want to say that I'm extremely proud of all of our child care providers. They're doing a wonderful job trying to stay open, and their biggest concern lately has been, trying to find cleaning supplies to make sure that they can keep everything clean and sanitized. I do think we've had a church step up and help them with that, so that's been really nice. Some of the other concerns that I've received, and like on both ends, providers, families, I've had some parents calling upset because providers, families, and providers aren't staying home and watching the stay-at-home order. And then on the other hand, there's providers upset that parents aren't continuing to do that as well with their kids. So I think it's just a catch-22, and I think that we all just have to remember that we all need to stay at home because it affects everyone.
So Julie, can you talk a little bit about the need to keep childcare services open, possibly for those essential workers, including healthcare workers who do need to go to work and can't necessarily, take their children with them or find other arrangements?
Right, it is very essential to have childcare providers at this time, or daycare is open at this time. We do follow KDHE guidelines, and KDHE has recommended that daycares stay open at this time.
And why did you feel it was important to be, a little more strict with childcare providers in the Riley County area?
We know that there is community spread in the area. We are a unique population as well. So we wanted to make sure that daycare providers were following certain provisions. And so we felt that this was very necessary. And of course, just to protect our children and their families.
Now, does this represent a change from the previous order, or is this just solely an extension of existing requirements?
Solely yeah.
Okay, thank you. Just wanted to make sure that was clear for everybody. Yeah.
An extension, yes.
Yeah. And Kurt, you were talking a little bit about social gatherings in the area and kind of the danger of even gathering in small groups, meeting with people who might be in your family but outside of your household. Can you talk a little bit more about what your officers are seeing? I know I kind of ask you that question every day, but since I'm stuck at home, I don't get a good sense of what's going on in the community. So if you could talk about that, I'd appreciate it.
Yeah, lately, especially with the weather, it's not been warm enough that a lot of people have been outside. But we saw when we had that uptick in warm weather last week, the gatherings started to occur. You start having little house parties, and this is a typical time in our normal times where, when the university students are here, everybody's wanting to get out and get together and have barbecues, get-togethers, house parties, etc., which again, normally are fine. But under the circumstance here, that creates a problem because, as she was talking about with the order for the daycares, I liked her word with the stable group. And I think that's the important thing of these house parties, these social get-togethers. is they tend to not be a stable group. So you don't really know where everyone's been, who's had contact with who. And as I talk about your sphere, your circle of influence, that starts to get bigger when you have those kinds of parties. And it's harder to maintain, one, the social distancing, but good hygiene. You don't know who's had contact with who, and it increases the chances for community spread as you increase your contacts with others. So we really need to watch that.
As we're all kind of looking toward the future with the hopes that, we might be able to get back to normal life, we focused a lot on this idea of a peak and a decline in numbers. Now that we have that, the extension of the stay-home order from the governor, and then the city's made some decisions to cancel summer activities, I'm trying to wrap my head around the idea that this could be still, quite a long time away before we can do some of the things that we're used to doing, gathering in the larger groups, going to concerts, going to events, that kind of thing. Julie or Kurt, can you talk a little bit about kind of that long haul for the community and what you envision for the future?
I think it's a good thing to remind the community how well we've done. We were considered second in the whole state as far as our social distancing grade. So we had a grade of an A-, which is really great. We've done a good job. So keep up the hard work. Keep that going. We don't want to let up too soon. So we still need to abide by that stay-at-home order. Stay at home unless you need essentials. It's so very important to do that. Looking at a peak, we were told by Dr. Lee Norman maybe at the end of this month, but it could be more early May. And then of course we'll have that recovery period too that we need to look at as well. So it's vital that we abide by that stay-at-home order and continue to practice those methods. We don't want to let up too soon.
I think it's important also to point out, I've seen some of the comments on Facebook in two different areas. One, wanting us to open things back up or us make certain changes here locally. And it's important for people to remember this is the governor's order, not blaming the governor, but it's the governor's order. And so we have to abide by that. So we as a EOC command group in Riley County can't change anything until the governor's order is lifted off of our, returns basically home rule to us. So when that occurs, we as a group have been talking and are trying to plan that de-escalation that she was talking about, that recovery period, and that's not easy. Also, I know that the city, in cutting some of their recreational programs, I think that's a good indicator. It's not I've seen some of the comments about, punishing us, et cetera. That shows that we as public servants also are affected by this, and budgets are being affected by the lack of the taxable income coming in. And those were decisions made that are budgetary primarily, and it's just something that we're all having to deal with. So as we all continue to work on this, we can get out of it sooner and get back to normal life sooner.
Heather, I wanted to ask you a little bit more. We talked before the recording started about, some other things you're hearing about social gatherings, maybe, people letting their teens go out and go to a party, go to a friend's house. Can you talk a little bit about that and what your advice might be for those situations? How could you talk to a teen and let them know that's not safe right now?
Well, I think as a parent, we have to really explain to them that the safety concerns and that it's not all about them. I know it's hard with teenagers. It's hard for them to think about anyone but themselves at this time in their lives, but it's not just about them. It's about aunts, it's about uncles, it's about grandma and grandpas. It's about if your parents run a daycare and they have the little kids in care and about protecting them and then those children that go home and they're around their parents and they're around their grandparents. It's a cycle, and we just have to think about everyone else and not just about ourselves at this time. And we're not trying to single anyone out. We know it's happening on both sides, so we just wanted to speak to it. and voice our concerns, and, you know, just remind everyone that we have to do what's best for everyone.
Vivian, you're muted.
Thank you. And thank you for that advice, Heather. Do we have any questions from the members of the media this time? I've kind of been monopolizing the questions. Okay, not seeing anything. Over the last few,
Sorry about
go ahead,
that.
Nick, I'm sorry,
This is,
go ahead.
This is Nick McNamara from K-Man, and I've been seeing some talk about the possibility to track the virus into houses through your shoes. Do you recommend any additional precautions being taken with shoes if you're going out into public areas?
Yeah, that's a good point, Nick. We were talking about this the other day, and I just automatically take off my shoes every day, regardless if we have a pandemic going on. But I think that's a good practice for people to take their shoes off because we know that it can live on surfaces, and we want to reduce any risk of exposure. So yes, that would be a good idea to do that.
Over the last week or so, or maybe longer, I know the Command Group has been working on this alternate care site, and some different ideas have come into play, and working with local medical providers to kind of see when and if the need were to arise that we need an alternate care site. Can you just talk to us about how those talks have progressed? What are some next steps? What are you seeing with regard to that?
Sure. So the EOC is in constant contact with our MHK COVID-19 Clinical Task Force and other members from the Healthcare Society to talk about when we would need to set something like that up. We are going to have something in place by the end of this week. That's not to say that we'll need to use it by the end of this week. Right now, there's really not a need for something like that. However, we were in discussion yesterday and today talking about what our triggers might be. So we are putting together a very detailed plan that will describe what those triggers might be and when we'll need to use that.
Okay, thank you so much. I'm trying to look and see if there are any additional questions on our Facebook page. There's some more questions about contact tracing, what that is, and what is the information that people can expect to be released from the Riley County Health Department with regard to, you know, where positive patients have traveled, what they've done, what people might need to know.
Sure. So when we do come across somebody who has tested positive, we of course make contact with them first. We want to know kind of that ring around who's been around them. And so we do reach out to those individuals. We let them know that they could have come in contact with somebody who did test positive and what their next steps are, which are basically to be quarantined for the next 14 days. We also want to monitor them on a daily basis. So we do reach out to them on a daily basis. We want to know things like symptoms with a positive individual. How are your symptoms? Have they progressed, or are they going away? What's your fever like? Are you still experiencing a fever? For them to be considered recovered, they have to be at least 3 days fever-free with no fever-reducing medicines, and then of course other symptoms need to be on the decline as well, and it has to be 7 days from the onset of symptoms. And then as far as other individuals who may have come in contact with that positive, we just need to keep monitoring them to make sure they don't have symptoms. The minute they have any symptoms, we want them to call that screening line, which again is 785-323-6400.
With regard to recovered patients, are they required to continue staying in quarantine, or at what point are they considered safe?
Yeah, when we establish those points to where we can say they are recovered, we will send them a letter that is from the health department. So they are able to go back to work at that time or whatever they need to do at that time. However, we want them to continue to monitor for symptoms. If they do ever have any more symptoms, of course, we want them to be quarantined right away and call their healthcare provider.
And Vivian, I wanted to touch to that too, that in the contact tracing, folks may find that some detectives will be contacting them and asking these questions. It's important for everyone to understand that that's being done in conjunction with the health department, and it's not a criminal investigation. The fact that they're using detectives has no bearing other than the fact that they have that skill set and time to make those contacts, trying to free up the health department employees to do some other things. Any of that information of who you had contact with, etc., isn't kept at the police department, nor are we releasing it really to the public because, again, we want to protect the privacy, medical privacy of those that are being contacted, and that's very important for all of us. So, but it does help us to protect those people that have been around anyone that's been in contact with someone who's positive, tying back to why we want to keep our circles tight.
I know we've talked in the past couple of days about some scams that are going around. Can you talk about how people can be aware that the person contacting them and asking for information really is from the health department or from the police department, and what sorts of questions will they be asking? Like, for instance, they're never going to ask for bank details or social security number, that kind of stuff. What will they be asking?
When they're going to be primarily asked about their contact with the person that may have been positive, a lot of questions surrounding that. Probably the key thing, though, is you should recognize the phone number as being from the police department, or if at all you question, just call the police department or call the health department to recontact whoever it is. But they should clearly identify themselves as an employee from the health department or a detective. Again, you can easily verify that by recontacting the agency. And if there's any question about where the questions are going, stop and recontact the police department or the health department. In fact, I'd encourage in that case to contact the police department so we can look into it with you as well.
Okay, thank you so much for that. We had a question on the Facebook page about something that the governor said as part of her order, that she's thinking the reduction in restrictions or the loosening of restrictions would happen after we see 14 days of decline. Can you talk? I know it's the governor's office who issued that statement and who would be interpreting it, but what does 14 days of decline look like? What does that number reference?
I would assume the decline in overall numbers or percentage of an increase. I'm not really sure because I didn't actually read that part of it. I haven't had a chance to, but that's what I assume. There has to be some sort of phase that we go through to be able to open places up. So we've been discussing that already in our command staff as well.
And I'm assuming we'll be doing some research on that, and we'll be in contact with the governor's office when the time comes to perhaps loosen restrictions.
Yes.
Okay. Are there any additional questions from the media at this time?
Hi, Nick McNamara from K-Man again. Since you were talking about the governor's orders, have you gotten a lot of communication from her about how things are going, and possibly talks about, she mentioned in the press conference about reopening the economy. Do you know if there's any have you gotten any communications about how that might be proceeding from her at our stage, and how they'd be cooperating on that?
Yeah, so usually how that goes, we usually get information directly from KDHE or from our Association of Local Health Departments. So they've been really good about getting that information to us. So we'll be in contact with them as far as that goes.
Okay, well, thank you very much. Do you have any final statements before we end our broadcast today?
None.
I want to thank everyone for their support and cooperation, and keep going at it. We're doing a good job.
Thank you, and thank you for all your hard work. We really appreciate it. And we will be back tomorrow at 4:15 with another hopefully live broadcast. Thank you.